Diabetes is a chronic condition that affects millions of people worldwide. While many are aware of the primary concerns related to diabetes, such as managing blood sugar levels and monitoring overall health, one aspect that often gets overlooked is the health of the feet. Diabetic foot complications are a significant and alarming issue that can lead to severe consequences if not addressed in a timely and appropriate manner. In this comprehensive guide, we will dive deep into each of the 10 alarming symptoms of diabetic foot complications, offering a detailed breakdown, insights, and actionable advice for each. Number 1. Numbness or tingling. Numbness or tingling sensations in the feet can be early indicators of diabetic foot complications. These symptoms are often linked to a condition called diabetic neuropathy, which is nerve damage caused by long-term uncontrolled blood sugar levels. Diabetic neuropathy can lead to loss of sensation in the feet, making it difficult to detect injuries, wounds, or temperature changes. This is a significant concern, as unnoticed injuries can progress to severe infections, ulcers, and in severe cases, amputations. Diabetic neuropathy can be a silent threat, as it can develop gradually without causing significant pain or discomfort. As a result, regular foot examinations are crucial for individuals with diabetes. If you experience numbness or tingling in your feet, consult your healthcare provider immediately. They may recommend lifestyle changes, medication adjustments, or physical therapy to manage this condition. It's important to note that maintaining well-controlled blood sugar levels can slow the progression of diabetic neuropathy. Number 2. Persistent swelling. Swelling in the feet and ankles, known as peripheral edema, is a concerning symptom for diabetics. It is often associated with poor blood circulation, a common complication of diabetes. Insufficient blood flow can lead to several problems, including the development of ulcers, infections, and delayed wound healing. Swelling in the lower extremities can be an early sign of these issues and should not be ignored. Peripheral edema is a result of the accumulation of fluid in the tissues of the feet and ankles. It can cause discomfort and limit mobility. If you notice persistent swelling, consult your healthcare provider to identify the underlying cause. They may recommend interventions such as compression stockings, medications, or lifestyle changes to improve circulation and reduce swelling. It's crucial to address this symptom promptly to prevent further complications. Number 3. Changes in skin color or temperature. The color and temperature of your feet can provide essential clues about your foot health. Abnormal changes, such as redness, bluish discoloration, or increased warmth, should raise a red flag. These changes often indicate problems with blood circulation, which can lead to tissue damage, ulcers, and infections. Altered skin color or temperature in the feet is a sign of poor blood flow, also known as peripheral artery disease, PAD. When blood flow is restricted, the affected areas may appear reddish due to inflammation or bluish due to oxygen deficiency. In contrast, increased warmth can be a result of inflammation and infection. If you notice such changes, seek immediate medical attention. Your healthcare provider will assess the severity of the issue and recommend treatments, which may include lifestyle changes, medication, or even surgical interventions to restore blood flow and prevent complications. Number 4. Slow healing sores or ulcers. One of the most alarming symptoms of diabetic foot complications is the presence of slow healing sores or ulcers on the feet. These open wounds are often painless, which can lead individuals to underestimate their severity. However, they are a clear indication of tissue damage and are prone to infection, making them a significant concern. Slow healing sores or ulcers are primarily associated with two conditions, neuropathy and peripheral vascular disease. Diabetic neuropathy can reduce your ability to feel pain or discomfort, making it difficult to notice injuries or pressure sores. In contrast, peripheral vascular disease restricts blood flow to the extremities, hindering the body's natural healing processes. When combined, these conditions create a perfect storm for non-healing ulcers. To address slow healing sores or ulcers, consult your healthcare provider or a wound care specialist. Treatment often involves wound cleaning, debridement, removal of dead tissue, infection control, and the use of specialized dressings. In severe cases, advanced interventions like hyperbaric oxygen therapy or surgery may be necessary. Early intervention is critical to prevent complications from progressing. Number 5. Ingrown toenails or fungal infections. Ingrown toenails and fungal infections are seemingly minor foot problems that can escalate rapidly for individuals with diabetes. These issues can lead to significant complications if left unattended. Proper foot care and regular inspection are essential to prevent the development of ingrown toenails or fungal infections. Ingrown toenails occur when the edge of a toenail grows into the surrounding skin, causing pain, redness, and the potential for infection. Fungal infections, on the other hand, can affect the skin between the toes, athlete's foot, or the toenails, onychomycosis. For people with diabetes, both conditions can lead to complications such as cellulitis, a bacterial skin infection, and in the case of ingrown toenails, even deeper infections that may require surgery. To prevent ingrown toenails, trim your nails straight across and avoid cutting into the corners. For fungal infections, practice good foot hygiene, keep your feet dry, and use antifungal creams or medications as recommended by your healthcare provider. If these issues persist or worsen, consult a podiatrist or foot specialist for proper management. Number 6. Corns and calluses. Corns and calluses are areas of thickened, hardened skin that can form on the feet due to friction or pressure. While they may seem minor, they can pose significant problems for individuals with diabetes. Over time, corns and calluses can become open sores or ulcers, increasing the risk of infection. Corns and calluses are common in people with diabetes because they often wear ill-fitting shoes or have altered foot mechanics due to neuropathy or deformities. These thickened areas of skin can lead to pain and discomfort, especially when they become deep or ulcerated. Preventing and managing corns and calluses involves choosing proper footwear, using cushioning insoles, and regular foot care. Consult a podiatrist or foot specialist for safe removal of these skin lesions. Number 7. Pain and discomfort. Persistent pain, burning, or discomfort in the feet should not be underestimated. While pain can have various causes, individuals with diabetes should take any discomfort seriously, as it could be a sign of underlying foot complications. Diabetic foot pain can result from multiple factors, including nerve damage, neuropathy, poor circulation, pressure sores, or infections. It's crucial to identify the source of the pain through a thorough examination by a healthcare provider. The treatment plan will depend on the underlying cause. This may include lifestyle modifications, medication, physical therapy, or specialized footwear to alleviate discomfort and prevent further complications. Number 8. Decreased hair growth. A subtle but important symptom to watch for is a decrease in hair growth on the feet and legs. This change can be indicative of poor blood circulation and is often related to peripheral artery disease, PAD. A reduction in hair growth on the lower extremities is a sign of reduced blood flow. This may lead to cold or numb feet and increase the risk of tissue damage, ulcers, and infections. To address this issue, your healthcare provider will evaluate your circulation and recommend appropriate interventions. These may include lifestyle changes, medications, or, in more severe cases, surgical procedures to restore blood flow to the affected areas. Number 9. Changes in foot shape. Alterations in the shape of your feet can be a cause for concern. Conditions like hammer toes or charcot foot can develop in individuals with diabetes and indicate significant complications. Hammer toes are deformities that cause the toes to bend abnormally, resembling a hammer. Charcot foot is a condition where the bones in the foot become weakened and deformed due to nerve damage. These changes can lead to balance issues, ulcers, and the need for specialized footwear. Consult a podiatrist or foot specialist for proper assessment and management. Treatments may involve orthopedic devices, braces, or surgical procedures to correct foot deformities and prevent further complications. Number 10. Loss of balance and coordination. Diabetic neuropathy can affect balance and coordination, leading to an increased risk of falls and injuries. A decline in your ability to balance is an alarming symptom that should be addressed promptly. Diabetic neuropathy can impair the nerves responsible for transmitting signals related to balance and coordination. This can result in unsteadiness, loss of balance, and an increased risk of falls. Falls can cause severe injuries, especially in individuals with diabetes who may have compromised bone health. If you experience a decline in balance and coordination, it's crucial to consult your healthcare provider for a thorough assessment. They may recommend physical therapy, balance exercises, and assistive devices to improve your stability and prevent falls. Preventing diabetic foot complications. Prevention is the cornerstone of diabetic foot care. Here are essential tips to keep your feet healthy and prevent complications. Maintain proper blood sugar control. Consistently manage your blood sugar levels through medication, diet, and exercise as advised by your healthcare team. Good blood sugar control is vital in preventing nerve damage and circulatory issues. Daily foot inspections. Make it a habit to inspect your feet daily, paying close attention to any changes such as cuts, blisters, or other abnormalities. Early detection can prevent complications. Proper foot hygiene. Wash your feet daily with mild soap and warm water, taking care to clean between the toes. Dry your feet thoroughly and apply moisturizer, but avoid applying it between the toes, as excessive moisture can promote fungal growth. Footwear matters. Choose comfortable, well-fitting shoes that provide support and protect your feet. Avoid high heels and shoes that are too tight. Orthopedic shoes or custom-made inserts may be recommended for some individuals. No barefoot walking. Avoid walking barefoot, even indoors, to protect your feet from injury. Regular podiatric checkups. Schedule regular appointments with a podiatrist or foot specialist for comprehensive foot examinations. They can identify issues early and provide guidance on proper foot care. Protect your feet. Be cautious around hot surfaces and sharp objects. Use sunscreen to protect your feet from sunburn and keep them warm in cold weather. Trim nails carefully. Cut your toenails straight across and avoid cutting into the corners. Seek professional help if you have difficulty trimming your nails. Manage comorbidities. Keep other health conditions, such as high blood pressure and high cholesterol, in check as they can worsen diabetic foot complications. Lifestyle modification. If you smoke, consider quitting, as smoking can impair circulation. Also, maintain a healthy weight through a balanced diet and regular exercise. Understanding and recognizing the alarming symptoms of diabetic foot complications is essential for preserving your quality of life. These symptoms should never be ignored, as early intervention can make a significant difference in the outcome. If you or a loved one has diabetes, share this information, as awareness can be a lifesaver. Remember, your feet are your foundation for mobility and independence, so taking care of them is an investment in your overall well-being. Don't ignore the signs. Act promptly to protect your feet and your overall health.